Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the wellness dentist, Dr. Katie Toe.
Welcome to the Wellness Dentist Podcast, Oral Health for Longevity. I'm Dr. Katie Toe, your host. And today I have not just one, but two special guests. One of them, a dear friend, amazing wellness dentist. And they have the thing that I admire the most is their partnership in business and in life too. So great friend in practice and outside practice. And there's a lot to learn from their collaboration and their partnership. So that's why I have them sit down and talk with us about this wellness journey and how the partnership actually elevated and how that impact both of them in their personal life. So welcome, Dr. Beena and Dr. Choi.
Well, thank you for having us.
Yes. Dr. Choi.
Yes, ma'am.
Since I already have a conversation with Dr. Beena, and you have to watch that episode. It's really, really great. Give us a bit of introductions. How do you get started? Especially you've been practicing for a long time with a lot of experience. And how do you get started in wellness journey for yourself?
First, Dr. John and I took a course on implants, in Puebla, Mexico. And so when we got back, we had a study club, and we would get together quarterly and go over the good, the bad, and the ugly regarding the implants. Yeah, because we were just starting out, and so we had
that was years ago.
Yeah,
yes,
yeah, we had no idea, how important vitamin D was, to have that in your system prior to placing an implant. And so, anyway, I just said, hey, when's your lease up at your place? And both in 2018, and so we've been friends since 2014 when we took that course. And so and we just kept in touch that way. And I just said, hey, would you like to partner up? She goes, yeah, I'd be really interested in that. And then Harvey hit, and so in 2017, her building had a lot of damage, and mine didn't. And so they called me and said, hey, we want to talk about partnering. Yeah, for sure. And so it was, I remember it's a cold February day, and her and her husband and brought the two kids in, and I was like, whoa, they're serious. And I said, so it really went really well. We talked about it, how to implement, and how we, divide the time that we're going to be there, because we had a small office.
Yes.
And so,
and remember the space.
Yeah. And so, we just went from there. And so she said, hey, let's think about getting some coaching, some consulting. And I said, yeah, I'm open to it, to see how we were going to go, because I was looking at a few years down the road into selling my half of the practice, or getting out and doing something else. And so she goes, and that's when we met you. And so Dr. John talked about wellness and wellness dentistry. I was like, man, I'm not going to do that.
And look at you now.
Yeah, you can do it, and I'll support you.
Yes.
And so, no, it got interesting. And one of the things that really clicked with me is patients that, earrings, for example, right? Some people can wear fake earrings, not real, or they have to be gold, because they have a reaction to that. And I thought, man, maybe there's something to that. And I just started seeing it in the mouth.
Yes.
And so different crowns, the tissue reacting not well with it, and that, having different metals in there. And so people were talking about becoming metal free. And so what would that involve? And that would be removing a lot of, silver or mercury amalgam fillings, And so we did, we decided, there's a niche for that, and people want that. And so, we can accommodate that. But we had to build a new facility, because we had open concept, and we didn't have any rooms that we could really isolate and really control the mercury vapor.
That's right.
And so I said, man, mercury vapor, And so as I started to explain to my patients, because we're more old school, right? They're like, well, some were receiving it, and others weren't. And so I didn't let that affect me. We just kept on the journey and kept reading and kept listening to podcasts regarding these things. And we joined the IAOMT and did the SMART certification. medication.
That's right.
Yeah, and then we did the ABDM and just learning things, the Protect protocol, going that route, and yeah, and just with ozone, just seeing how much ozone, using that, in our practice for after we prep filling, using it, and how sensitivity wasn't there anymore, and just these things. I said, well, maybe there's something to it, and we.
It's really cool coming from you because you're like, wellness what? I've been doing this. How long you been practicing?
33 years now.
Okay.
Mm-hmm.
So I think that a lot of dentists we have a lot of dentists listen to the show and they'll be like, wow,
Yeah.
love your open mindedness
Mm.
and the fact that you trust your partner
Mm-hmm.
because she came to you and Dr. Beena, you're going to have to give us a little bit of like what interested you to be like, come to your partner and say, hey, we're doing wellness now.
Yeah. So again, my journey into it was stemmed from my mom suffering from Alzheimer's and dementia. And to me, that is such a debilitating disease that I just didn't want anyone, especially I didn't want to go through it.
Mm-hmm.
So maybe it was a selfish motive that started. I was like, what causes this? Because I don't want to go through this. And then started looking into it and then found out the mouth plays such a huge part in this.
Mm-hmm.
And then the bacteria in the mouth and mercury fillings and sleep and so many, and mold that is present underneath a lot of these mercury fillings,
Mhm.
and just toxicity, heavy metal toxicity. And like Dr. Troy said, just sensitivities to things that we never really think, does that play a role in the mouth? What are we putting in the mouth? So just all of this started my curiosity into wellness dentistry. And again, nothing happens by chance. Me meeting Dr. Troy didn't happen by chance. To me,
Mhm.
I believe everything is divine encounters.
Yes.
And God brought us in this place, and every person and every patient that walks in is a divine appointment.
Yes.
And so,
Amen.
yes, I believe that, that's how I got to know you through a course. And you were so kind to like give us your phone. And I was like, who does that? Who gives their cell phone numbers to a whole class?
Yes.
But you did. And you answered when I called. And I was just like blown away with just those little simple things. And then I talked to you for a little bit. And then I talked to Troy, and he was so open to hear from you, and again, he has been practicing way more than any of us. And so, but he just had an open mind
Mm-hmm.
to listen and to hear. And yeah, let's look into
Mm-hmm.
wellness dentistry. Let's look into it. Let's see what this is about. He was skeptical, but open.
Yes.
And then when we started seeing the results, we're like, no one's calling us for sensitivity, like he said.
Mm-hmm.
We do ozone, and like no one has issues with that, and then again, once we incorporated the microscope, and we're like, you just had a cleaning somewhere else. Let's look at that slide, and there's all these bugs,
Pathogens and
just
Parasite.
crawling all over your mouth.
Mhm.
And so, we incorporated guided biofilm therapy and just the different modalities to really take care of your mouth, and that your mouth is a part of your body.
Yeah,
And it
it's a
affects
gateway. Mhm.
everything in
You're
your
right.
body. So,
You're right. And so, Troy, you also have your personal wellness journey because I remember you really into sleep medicine,
Mm-hmm.
like sleep dentistry, because you were a patient yourself.
Correct.
So,
Yeah.
can you share with us what have you tried? What have you experienced as a patient?
Mm-hmm.
And how that really turned into what you're doing in your practice? Now you screen everyone.
Sure. Yeah. And so, yeah, with me, it was sleep or lack thereof. And so I thought that breathing through your mouth was normal. I thought that's the way you're supposed to breathe. I had no idea that I had a deviated septum.
Mhm.
And when I found that out, well, I went ahead and had surgery to correct that so that
Yes.
we can breathe through the nostril, and it just made sense to me that we're supposed to breathe through our nose. And so I started learning about the CPAP, of course, first of all, and how that helps,
It's a management tool.
yeah, it's
Yes.
management, manage your sleep, correct, with the continuous positive air pressure.
That's right.
And so just learning these things that were coming out, 20 years ago, and slowly, I said, yeah, well, sleep is part of it, right? Nutrition and exercise, these things too. But now I believe that sleep is the most important thing to get proper sleep, and that people, I know, noticed that people were taking like Advil PM, Tylenol PM to get some sleep, but how dangerous that is to have crystals on the brain leading to early onset Alzheimer's or dementia and things to that nature. So I said, no, there's got to be a different route.
Yeah.
And so, yeah, look, diving into airway, and then finding out about oral appliances to help manage sleep again,
Yes.
and how that helped me
Yes.
bringing the jaw forward
Yes.
and open the airway, and taking courses, more and more courses, and then learning these things really, really helped. And so I myself wear a nasal strip.
Yes.
Yeah, I wear the CPAP, and I wear an oil appliance to help open the airway so that I get more air.
Yeah.
And so we're real excited because we just got a Fotona, and so we're getting it put together on Monday, in fact.
Yes.
And so we're going to learn about that so we can reduce the
You can be the first patients
yeah.
for NightLase.
Yes.
It's an FDA approval for snoring. And we know sleep, when we talk about airway and sleep, is a very complex. Just like
Very
Dr. Troy
complex.
mentioned, you have to have your sinus and the nasal deviation septum
Yep.
surgery, and then you have to do the positive pressure to manage it
Yeah.
while you are doing on other things.
Right.
While some of people after the nasal surgery or the appliance, they lost weight,
Mhm.
and that helped with the tissue at the neck.
Airway.
That also help with open up the airway. So it is a lot of moving part.
Mhm.
And some of the patient that you also share that they need jaw surgery.
Mhm.
So it's not a one size, again, it's not a one size fit all.
Correct.
Some people would ready for management right now.
Mhm.
Some people would want to go all into the surgery.
Yeah.
And so the good things about us, we have the team to do that.
Mhm.
You having ENT on your team, you having oral surgeon on your team, you have myofunctional therapist on your team, and you
Orthodontist.
learn, orthodontist, and you learn that you don't just look at the patient neck size
Yep.
anymore,
Yep.
because they could be 18 and skinny,
Oh, yes.
or they could be 70
Yes.
and nobody never told them that they have tongue tie, that they have airway issue. No one ever told them. And so I love the fact that you don't just look at the patient and say, no, you don't have sleep apnea. You screen them
Mhm.
by giving them the home sleep test.
Yes. And
Yeah.
so, and then diving into the whole wellness, I just started thinking too, because our eyeballs are connected to our brain,
Yeah.
right? And we have our
It's a part of our brain that outside our brain.
Yeah.
It is.
Yeah,
Yes.
it is.
Yeah.
But there's a separate insurance for all that, eyes, mouth, and then body, medical insurance. So I'm like, it's all connected. Why isn't it just one? So that, opened my eyes too. And I started looking at different things, and I'm like, yeah, this begins here.
Yeah.
And so looking for bony tori, people grinding their teeth, and the relationship with that. And then just talking to them, sowing that seed early on. And we sowed a seed, I don't know, 5 years ago, to one of my patients, old school patients. And he's like, hey, you mentioned that about sleep. My doctor mentioned it. He told me I could use a mouthpiece. Do you make those? I said, yeah, absolutely, we do. And how we
I've actually used them.
yeah,
Yes.
for sure. Yeah. And so it's taken off, there's a slow curve going up.
It's awareness. People are more aware of it now.
Mm-hmm.
Yep.
Yeah. And so how important sleep is to get proper REM sleep and deep sleep, and how, what percent of our sleep is in those stages,
Yeah.
And,
Troy, I know you for years now, and I can tell that when you really dial your sleep, you have so much energy, because you were like, when I first met you, you were like, Katie, I don't think I'm practiced for that long. Like, I'm actually planning my exit. That's what he told me when I first
exit
worked
strategy
with Dr. Beena and Dr. Troy. And now he's like, no, I want to do this.
Yeah.
This is fun.
Mhm.
This is, cool when you see the transformation in the patient, because I actually, Beena, you agree? You see the transformations in
Yeah.
him.
Yes.
And from that one location that they joined, they actually opened a 2,800 square feet brand new wellness dentistry facility. I'm telling you, you have to visit. It's the best in Sugar Land, Texas, for sure. And without a proper sleep, you're not going to have the energy and the motivation to start something new when you was so ready to get out.
Correct.
Am I right?
Yeah.
Yes.
Well, I have a vision. We have a vision for a
Yes.
spa next door, to implement that.
Yes.
Yeah. We
Yes.
have the room in our building to do that. So we'll see. Our vision is just kind of growing, getting out there.
Because it's not only fun, but you see how much transformation that you receive and your patient receive, and you're like, why not doing more for other people out there that, number one, don't know? They probably now hear the podcast and say, oh my God, I need to get my screening. Need to come to you to do that. But also people that are struggling, like try everything. Like I've seen people come in with a bag of so many stuff and then medication and supplement. And they we have one on the podcast recently, and she's have the medical file and test so thick. And she traveled the country to go see every specialist that were told that could help her, and nothing helped her, and it start from her mouth. And so I know you have all the specialists and the connections, and you're helping so many patients. So that's why we're like, get the message out there. Here's the cool thing I think about both of you that's so unique in this wellness space is the partnership. Not only in the experience, but also the dynamic of a female and a male doctor in the practice, but also the fact that you guys just start something new. Like not just new implementation, but new facility.
Yes.
And now you talk about expansion. I love that. So Beena, share with me a little bit about this partnership, because personal wellness journey, both of you, but then when you're implementing this, your team, your family, and how do you talk to each other and say, hey, trust me, this is the right way? Or you just say like, hey, we pivot when we need to. What going through your mind in this partnership when you implement this wellness? Because it's very different from what you used to do. And people don't know the investment is huge. In the new space, in the technology, in the training, it's a lot. And I remember at one point you're like, man, this is a lot. This is a lot. So how you communicate this partnership to really push through that?
Well, every time, we see, we learn, we understand what is out there in the wellness space. We talk about it with a lot of excitement. we both, we are again open-minded. Right. And so we are here both now, even if one person is not maybe a little bit more nervous to get into something in one of the aspects of this wellness journey that we're on, the other one is there to encourage. And so that has always been our go-to. If even, for example, we mentioned getting the Fotona. I was nervous about it because I was like, this is an expensive piece of
Very big investment.
It's a big investment. But Troy would be the person that is so encouraging and bringing out the aspects of how we can use this to serve our patients. What all we can do with it, right? And then talk about it, bring out that excitement and see how we can expand. Well, yeah, we can. So that's how slowly the vision of maybe we can have a spa, maybe we can expand to more things, right? And so when that excitement builds, oh yeah, you're ready for it. So that's kind of been our go-to. If we're both very open. Again, not, and I think that is important. At the same time, listening. I think we just, if we discuss something and if this is not the right time for something, we bring out why, we talk about it. And I think communication between us has been very key.
Yeah.
That
very
has been
open too.
Very open.
And, I have to remind everyone that conversation do bring clarity.
Yeah.
No matter it's a yes or no, you'll be like, why? Why not now? Why now?
Yes.
And a lot of time when people practice alone, who do they talk to? Their mind.
Yeah.
So it just go in circle. Like, they don't have anyone to kind of like bounce the idea
Right.
and really talk the fear out of it. Because you were scared to commit to that
Correct.
Fotona because it's such a big investment. And not only that, you had to implement on like the training
Yes.
and the conversation and the talk, because you don't want patient to not feel that you're confident about this, even though you know how to do it.
Right.
And so it is a lot. It's not just a one decision. It's like a series of action plan. And so I think people forget that they have to have the conversation. If you don't have a partner that cool as Troy or Beena, you can find a coach or somebody
Yeah.
or a friend that been through already, right? That done it. Like, not the people that never done it. They're going to talk you out of it. They're going to be like, oh, no, don't do that. But the people that done it successfully, the people that you want to model,
Yes.
talk to those people and say, how do you make that work? Is it a right time for me? Because we remember this time we say it's not the right
It's
time.
all right, yeah.
And so I think that the partnership, the secret sauce for your partnership is you such an open communication, and you really put the practice and the partnership first versus like a personal agenda. I don't want to learn, so no, that's a no.
Yeah.
But you be like, no, let's see how we can serve patients. So Troy, how about you?
Yeah, and so because we started the partnership before this wellness journey, and it did start with the implants, and that's how we met. But money is a tool, and it's necessary. So what it does is we encourage each other to do more, and it's not like a 50-50 split, right? Where I would say, okay, Beena, you do all the work, I'm going to get 50% anyway, and that doesn't work that way. It's based on our collections, right? So whoever based on the percentage of collections is how we divide our split, if you will. And so, we've always encouraged each other to do more. For example, we even share patients, I'll go in and I'll do the extraction a lot of times, and then we'll do the EAV and clean it out. And then she'll jump in and do the bone graft and the membrane and with the PRF. Implementing PRF and, with the sticky bone it's your turn. You go in there. And that it's so awesome. And
I actually model you guys now. I have my partners doing the same thing. They go in and the patient love that.
And a lot of times 3 days a week we have double hygiene, 2 hygiene, and so if she's doing a big case in there, I support her and I'll check hygiene, and it's awesome. It's wonderful. I'm there to support her if she has any issues, doing an extraction, or if her hand's cramping up or what have you. I get jump in and help. We help each other that way. And just bouncing everyday life off of each other. You're not one person taking on all this, all these investments and bills and having to pay everything back yourself. That I don't know how to. It's such a relief. To be able to do that. And she's super smart, super talented. And so it's a blessing to have her as a partner for sure.
Yeah. No, I love that. And even people that thinking about partnerships or in the partnership right now, but not have that open communication, they can be like, no matter you're a husband and wife or friends or joy in a business, anything in every relationship, communication is key. And we actually this year in our team, we said over communicated. Like you have to, you don't assume the other person knows.
You cannot.
You have to say it until the other person's like, I got it. I'm on the same page. Let's do it. So I love that about you too. And even in teaching, I'm learning, even I'm coaching your teams or working with you too. I also see that and say, hey, I don't want to practice by myself anymore. Because I love what you guys have. And I was like, the fact that when your mom needs you, you have Troy hold out the practice and say, go and be with your family.
Correct.
Right? And then when Troy needs that time for his personal time for his family, you said, Troy, go do that. And you guys both take really good amount of rest to refresh and come back and serve the patient. And I've seen a lot of dentists struggling with that. They can't take the time off. They burn out. Right. We see that. And so I, working with you guys, I told Don, I don't want to work by myself. And that's when we have Dr. Lou, and now we have Dr. Jones, and we have Dr. Rosalie. So I thank you too for really inspire me. And knowing that there's more in partnerships, there's more in collaboration, and you don't have to do this alone. Doesn't mean you have to have a partners, but I'm just saying that if you see that, hey, this is the key to partnership, the communication, and I can do that, then that's going to work.
Sure.
Yeah.
Well, we've had our coming to Jesus meetings,
Of course. We have that in our marriage too, right?
Exactly.
Yeah.
There's give and take.
You
Yeah.
are marriage in business.
Yes. Yes.
So, yeah.
Yes.
So, as long as you respect each other and you have the open communication and having a coach sometimes help. You'd be like, hey, what do we do?
Yes.
A tiebreaker.
Yeah.
I love that. So, I think a lot of people kind of reminder for them that they expect the other person get it.
Mhm.
But if you open communicate and you really tell each other the plan and trust each other, things gonna work out.
Yes.
Isn't
Yeah.
that?
Yes.
Yeah.
Yeah.
So I love that.
Open and honest.
Yes.
Mhm.
And both of you are really amazing leader in your practice. I met your team. I trained them. Our team loved your team. And so give us, and I know leadership is all about role modeling because you doing what you say you do, right? So give me your 3 wellness non-negotiable takeaway that you're doing every day. So people can really like, oh, that's what leadership's about. Leadership is about if you want to implement wellness, it's not just happen at work.
Mhm.
It's also happen after work, before work,
Yes.
on the day off, which means every day. So Dr. Choi, you go first.
Yeah, so one of the things, first thing in the morning, right, is my prayer and meditation. It's by Oswald Chambers that I read every day. My wife and I, we share that. And it's called My Utmost for His Highest. And that's a non-negotiable for us that we have to do that. And so another thing that I do is I'm reading at least 10 pages a day.
Yes.
Reading is just, I've committed to reading a book a month.
Yes.
And I'm getting more than that done. Yes, and having the Audible helps, and I get the hardback or paperback, and I read along as I listen, and it really to help for it to stick, to really understand what I'm reading, and I can stop it and do what have you. But yeah, I've really enjoyed that, and of course trying to get the 10,000 steps in a day. Yeah, and so I've committed to going to the gym. We have a Anytime Fitness in our complex, and so yeah, I'm here, and it's so much easier now to make that commitment and then go over there and get steps in and staying hydrated. That's another non-negotiable for me.
I see you show up on the book club last year every month. So
Yeah.
I love that habit stick with you.
Yes.
Yes, because we, a lot of patients was how these dentists know so much about medical, because honestly, they did not teach us that in school,
No,
right? You're
sure.
going to be the proof of that. You've been out for 33 years doing this, and they did not teach us blood work. They did not teach us sleep. They don't really connect them out. I don't think they have enough time, honestly, in school, and also the curriculums are also outdated.
Sure.
But by learning, just not taking the courses, but by listening to the podcast, reading these books, and really connecting what we're doing with what we're reading. Like that's what the book club is about. Like, hey, they're teaching this in the book, but how do we bring that into our dental practice and help our patients? So I appreciate it. This make my heart really happy knowing you keep up with that.
Yeah.
So that's awesome. How about you, Dr. Beena?
So for me, one non-negotiable is sleep. And practicing sleep hygiene, because for my mom, sleep was a big issue. So I think that's what kind of draw me to really making sure my sleeping at the same time as much as possible.
That's right.
Yeah,
Not just sleep, but the time, the consistency.
Yes. So I always try to sleep at the same time. And I practice the sleep hygiene. One of the things I do for my sleep hygiene is doing a nasal rinse, a sinus rinse, making sure I can breathe through my nose, and then wearing my sleep appliance. So that's a non-negotiable for me. And then I do take a magnesium. So I do get really, really good sound sleep.
Yes.
Yeah. And so that's important. And then the other thing I do is I listen to a Daily Fire by Growth Day app. And
Brendan Bashar. Yes.
yes, exactly. So that's been my motivation every day, and I'm able to motivate our team daily for our morning huddle. We use that, and I give them a little synopsis of what I listen to and how I find that we can implement that as a team personally and as well as a team. And then the other one was movement, some form of movement. I try to do, I hope to get 10,000 steps a day. And even if I don't, I've at least moved, even if it's 3,000 or 4,000. And then I also used the Life Pro vibration plate.
Mm-hmm.
So I love standing on that. So that's like a really nice relaxation for me.
Mm-hmm.
But it works out my muscles. So I know I'm getting, some strength training
Yeah.
there too.
I love that because a lot of time we thinking like, oh, especially us when we're busy, we walk around, we stand up, we're moving so much. At the end of the day, you're tired. You
Yeah.
can feel it. But then when you look at the step, you're like, what do you mean 3,000-4,000 steps? I thought I'd be like 10,000-20,000 steps by now. So it's a really good reminder that you need to track your step, because no matter how busy you are, you may be on your feet a lot, but steps are different, movings are different.
Yeah.
So a lot of time we on Zoom and I see people like walkings,
Yeah.
doing things. So I love that it's a constant reminder
Yeah.
that we have to get that in. And I think the daily fire is a good tip for not just the dentist listen to the show, but also the patient, because it's just not physical body. It's also the mindset,
Yes.
the mental health, the spiritual
Spiritual
health.
health.
Yeah, like the praying, the meditation, like all of that make wellness. It's not just focus on the physical. And when we look at patient, we look at that too. We don't look just blood work and the x-rays and the CBCT and the exam, but we also look, if this person get up in the morning, how's the energy level? Are they stressed? Like we have that on our exam. So
Yeah.
we want you to really pay attention to your body, not just the physical, but emotional, spiritual. And I deeply grateful for both of you here on a Saturday morning, guys, to record this session with us and really share about your partnership. Inspires so many people. Maybe they not think about partnership right now, but they will be like, consider that when
Well, stay open.
opportunity. Yeah,
Just
Yeah.
stay
expect
open.
when you stay open,
Yeah.
maybe that person will come.
Would
Yes.
show up.
Yes.
Because you did that in the implant
Exactly.
course.
Yeah.
You'll keep in
Exactly.
touch. You didn't become partner 4 years later,
Mhm.
right?
Right.
2014
Right.
and 2018.
18.
So again, no one sent to anyone by accident. The person you sit next to at the C course could be your partner.
Never know.
And so stay in touch and
Yeah.
really be open-minded about that. I'm grateful for that inspiration from both of you. And again, if you get to see Dr. Beena and Dr. Troy at Eagle
Dental.
Texas Dental Wellness Center now,
We're
Yes,
the name.
yes. you
A
will
mouthful.
got not just to meet one doctor, but both of them, because they wonderful and complement each other too. So
All right.
yes, and you guys, the skill of both of you add up is powerful, because it's
Thanks.
gonna take me 33 years to get to that skill level. So thank you again for joining us and share with our listener and audience. How do they reach out to both of you and your practice?
So our Instagram handle we have for our office is Eagle Dental Texas.
Mm-hmm.
For Facebook is the same, Eagle Dental Texas or Eagle Dental Wellness Center of Texas.
Mm-hmm.
And then we also have an Instagram page. Mine is Dr. Beena.
Mm-hmm.
And yeah.
Yeah, reach out, ask questions, and they'd be happy to help. And thank you so much for today. And guys, subscribe, follow Dr. Beena, follow the Eagle Dental Texas Dental Wellness Center. I love the Dental Wellness Center name. And make sure that you subscribe, and see you guys at the next episode.
Thank you.
Thank you.
Thank you.
Bye.